Hi, my name is Allison Summers, and my presentation is on human immunodeficiency virus, or HIV. A little history of the virus is that the origin of HIV was traced to two different strains of an HIV-like virus called SIV. It's predicted to have been transmitted to humans through consumption of infected monkeys by hunters in Africa. HIV started spreading through the migration of humans and the sex trade. It eventually found its way to the United States around 1970 in New York City, and from here on out, it started to spread all around the globe. The HIV virus is part of the retrovirus family and the lentivirus genus, so it relies on RNA for its genetic material. This virus infects your T cells, but more specifically, the CD4 immune cells. It is a single-stranded RNA virus that has reverse transcriptase in the capsid to convert to DNA. But we'll talk about that on the next slide. At the end of 2018, there were 1.2 million people in the United States diagnosed with HIV, but a 7% decrease in the diagnoses, and a 38 million people around the world. The mechanism of action is a protein-to-protein interaction that allows a certain glycoprotein of the virus to bind to the CD4 receptor on the host cell. This will create a channel, inserting the virus membrane into the target cell, and that viral envelope is then created. That previously mentioned HIV reverse transcriptase on the previous slide will now turn that single-stranded RNA into complementary DNA in the cytoplasm of the CD4 cell. This DNA is transported into the nucleus via nucleopores, completing this infection. Once these CD4 cells are infected, it is a continuous reproduction of the virus and eventually causing the cells to die early, which in turn weakens the immune system. The transmission of HIV is through unprotected sexual contact with an infected partner, sharing of needles and syringes via tattoos or piercings, but that is very rare as there is no known cases this way, or through drug equipment. Also, mother to baby or vertical transmission during pregnancy and breastfeeding. Also, blood transfusions, but that is very rare as blood is screened very thoroughly. It is not transmitted by touching of surfaces, insect bites, or simple bodily fluids such as tears or sweat. There are three different types of stages of HIV. First stage is the acute stage. This person may show flu-like symptoms, but may also be asymptomatic. It is a very contagious stage as there is a high viral load. If it is left untreated or undiagnosed, it can lead to the next stages. Stage 2 is the chronic or clinical latency stage. The individual might not be showing any symptoms here, but the viral load increases, which will decrease the amount of CD4 cells. If the individual is taking medications, it is possible to never progress to the next stage. The last stage is the acquired immunodeficiency syndrome stage, or also AIDS. This is the most severe stage of them all due to the very minimal amount of white blood cells. This leads to an immune system failure, which leads the individual to be very prone to infections. Without treatment, the estimated survival time is about 3 years. Treatment and prevention. There's quite a few treatment options, such as the antiretroviral therapy, or ART. This therapy is a combination of medications that block replicating enzymes, inhibit the infection of CD4 cells through inhibiting the production of certain enzymes, and the pharmacokinetic enhancers, which allows the medication to stay in the body longer. There is also the PrEP and the PEP medications, which are used by individuals who are at the higher risk community. The best prevention of HIV is protection during intercourse, And let's also not share any needles. Unfortunately, there is no immunity towards HIV, but if you are one of the lucky 1% of the population with a deletion mutation, your chances of contracting HIV is greatly reduced. Studies showed that you are not immune, but it would take more infected fluids for you to actually contract the virus. Over the years, there has been multiple attempts to create a vaccine, but in 2017, a trial failed as it actually increased the HIV infection rate. But this did show that we cannot just strengthen our immune system to stop the virus. There is a few testing and diagnostic ways here. The first one is the CD4 lymphocyte count. It can keep an eye on how HIV is affecting your immune system. This is a diagnostic test for AIDS the as it counts the white blood cells in your blood. If you have 200 or less cells per cubic milliliter, you have officially reached the AIDS stage. The nucleic acid test is a blood test that measures the viral load in one's blood. This test, you can know your results sooner than the others, but it is very expensive. If you believe you've been exposed, this is a good test as it can detect as early as 10 days after the exposure. Another test is the antigen antibody test. It looks for both antibodies and antigens in your blood. Your body produces the PT4 antigen before any antibodies are even produced, so it looks for that. Then you also have the regular antibody test, which just looks only for the antibodies. So which of these tests do you believe would be the best? Who is affected? The amount of data on who is affected is almost endless. There's categories upon categories and subcategories upon subcategories. But when looking at all the different data, race and ethnicity and the transmission mode is the most prominent. As we can see here, the African American Black community is at most at risk with almost doubling the risk of the others. With the transmission mode, we can see that male-to-male contact leads with the most at risk, but it is still pretty prominent within hetero contact as well. I have two different charts here that break down both of these variables. That is it for my presentation. Thank you for listening, and here are my resources.